Many times you'll hear a general chiropractor suggest that patients return 3 times per week for an undisclosed amount of time. This can be costly, and in the end, nothing has been corrected. And frequently, the spine is too mobile due to all of the popping, cracking, and twisting of the spine, leading to a condition called hypermobility. With NUCCA, our goal is to help you heal so that your spine becomes more stable and healthy over time. So a question I'm often asked is, how long will it take to get better? Well, the answer is, it depends. There's 5 main factors involved in the rehabilitative healing process. The severity and complexity of the misalignment that we're dealing with, the underlying damage that is present in the spine, damage to the discs and the ligaments and the nerves, the joints, and so forth, the lifestyle factors involved. How is your diet? What's your exercise routine like? How do you handle stress? Your age. The older you are, most likely the more difficult it is and the longer it will take for you to heal. And the willingness of the patient to follow directions to get well. Now, different parts of the body take different amounts of time to heal. Muscles, ligaments, and tendons, which is mostly what's around the spine, holds it in place, take about 90 to 120 days to heal. Nerves take longer. Nerves can take anywhere from 6 to 18 months for nerves to fully heal. Now, there are 3 phases of rehabilitation when it comes to correcting misalignments in the spine. The initial intensive phase. Now, this is when we're retraining the body to begin to hold the corrections. Most adult patients need to be checked about every 3 days initially for 30 to 60 days. As the body changes, soreness over scoliosis sites or areas of curvature can happen. Even old injury areas can get sore. For example, an old knee injury or shoulder injury, as we change the distribution of weight in the position of the spine, can get sore as finally true healing is taking place in those areas. Next is the healing phase. At this point, the body begins to stay in alignment longer periods of time. Proper blood and nerve flow to the damaged areas allows healing to take place in the muscles, ligaments, and tendons. Typically, this phase takes between 30 to 60 days, depending on the severity of the condition, and patients need to be checked about every 7 to 10 days. Stabilization phase is next. After that initial 90 to 120 days, patients are typically able to move into the stabilization phase. This phase is crucial for nerve healing and stability of the spine going forward. A gradual stair-stepping out of visits allows the spine to get stronger and hold longer. The goal always being to be corrected as infrequently as possible, but still stay in alignment. Typically, patients are checked every 14 to 28 days and are seen less and less frequently over time in this phase. Now, our patients will respond symptomatically in one of 3 ways. Immediate improvement, sometimes complete resolution of symptoms on the very first visit. This is the miracle case. About 25% of patients are in this category and have that wow experience immediately in the first week. Next is the steady improvement category. This is consistent improvement through that first 90 to 120 days and beyond, and that's about the other 50% of our patients. The last 25% is in that slower improvement category. This can be little to no change initially. As the patient holds the corrections longer, they will do better and better. On average, 90% of NUCCA patients will see improvement within the first 30 days. But ultimate recovery is based on how you hold the corrections. Holding is healing. It's not about being adjusted thousands of times. When the body is in that healing position, a correction will never be given. When the hips and legs are level and balanced, there's no signs that you have an atlas subluxation complex or that misalignment, and so we leave it alone. Most people have never been through a true healing process. Drugs and delay frequently smooth over conditions until the body adapts. At times, even when in alignment, you will not feel good. You can even have some detox type symptoms as your body heals. Headaches, dizziness, digestive changes can happen in the initial phases of care. Every experience that you've ever had is housed in your central nervous system. And as we change that way that central nervous system works, at times even emotions can change as your body heals. What will help you to get better faster? Number 1, keeping all of your appointments. Momentum is the key in correcting long-standing problems. Your visits are timed at certain points in order to address the misalignment when it's most likely to come back around. Next is following your do's and don'ts. Watch the Holding Your Correction video for more info on that. Third is using ice and drinking lots of water. Keeping inflammation under control and keeping your body well hydrated will allow you to get better faster. 4 is, at times, proper supplementation is necessary, things like fish oils and other supplements. Number 5 is avoiding covering up the problems with drugs. Pain pills, muscle relaxers, sleeping pills, all these types of medications commonly have side effects associated with them where they weaken the ligaments, which makes the corrections harder to hold. And lastly, teamwork between the doctor and the patient is extremely important. Communicating to your doctor if you have a fall or you're in a car accident. If you hit your head, tell us. Any head or neck trauma should be reported as soon as possible to your doctor. You may need to be thoroughly evaluated to see if things have changed with your misalignment pattern.